Time now for a look at your health, and tonight we'll focus on the most common sexually transmitted disease here in the U.S. There is a vaccine for it. We've talked about it before, yet many parents are hesitant to get their kids vaccinated. So joining me now to talk more about HPV and the new vaccine recommendations that just came out is Dr. Mitchel Goldman from UCSD. Thank you for being here.
Good to be here.
Well, let's talk about what the Academy of Pediatrics had to say about the HPV vaccine.
What they had to say is that boys should be getting vaccinated as well. You know, Gardasil is a vaccine that's recommended for all young women between the ages of 11 and 12. And that's because when you're younger, you can develop a better immune response to it. But now the Academy of Pediatricians said that really boys should be getting vaccinated as well. And there's two reasons. One, there are about 7,000 deaths that can be prevented in boys from getting the vaccine. But even more importantly, as we were talking off air, men need to man up. Boys need to take responsibility for stopping the spread of the human papillomavirus, or HPV.
And these are cancer-causing cells in HPV, whether it's in a woman or a man. So that's something that...
But it is much more common in women. For some reason, the cervical area of a woman is much more prone to develop cancer than the penis of a boy. But these can also happen in the mouth. And so the viruses can be spread in many different locations depending on your sexual practice.
There's been a lot of debate about not only whether I should get this for my child, but at what age.
Yes, and what the American Academy of Pediatrics recommends is, again, between 11 and 12 is
both male and females?
both male and females, the ideal age to develop that immunologic reaction. But if you haven't gotten it that age, you can still get it even between the ages of 20 and 26. It's not that effective after the age of 26.
Now, another thing that's mysterious about HPV is there's not necessarily outward symptoms, right, in a lot of cases?
In women, there's not that many outward symptoms. Of course, there could be some around various genital areas, but in men, you're going to see them. You're going to see warty growths that are usually on the penis or the base of the penis, and that's how a guy is going to know that he has those.
And how young are we seeing, I guess you should say, children or tweens developing these sexually transmitted diseases?
Well, unfortunately, people are not just saying no, and they are not practicing safe sex. And so we are seeing young men and women as early as 12 and 13 coming down with venereal warts, which means human papillomavirus.
On a final note, let's talk about the potential danger of the vaccine, because it became very political, and people saying that it caused mental retardation and all kinds of other claims.
You know, people will say many things, but unfortunately, you can say anything you want and it's not founded in science. There has never been any study whatsoever which says that the HPV vaccine, Gardasil, causes any health problems in men or women of any age.
All right, we'll end it on that note. Dr. Mitchel Goldman, thank you for being here. And of course, Lauren, you always want to consult your pediatrician, because your child's own health and health history certainly plays into the scenario.
All right, tough to talk about, but important information. Thank you.